to this special meeting. This special meeting that we are holding in response to the board's desire, and of course members of our community, to discuss the issue or the topic of the vaccine mandate within our campuses. Just to refresh everyone's memory for how this progressed to this meeting, of course, the decision to not mandate vaccines for our campuses went through by our administration team and our leadership team that we have given the authority to do so. Then we are now in the process of discussing that further. I know some new information came to our communities via the Delta variant, community members voicing their concern, students, faculty, and the members of our board. And so the steps that we took to get to where we are is to have further discussion, to have a report from our administration, to update us on the information since the decision was made, and in hopes for us to basically have a better understanding for whether or not we want to continue and stay the course with this decision, or discuss as a board whether or not we want to vote to have that decision changed or reversed. I just want to reiterate that this is not the board versus administration. This is not the board versus the community. This is a legitimate discussion around a serious issue with, information is always coming through, and science and facts are always updating our understanding of things. And this is simply us surfacing the concern that's coming from our, again, members of the community and the board, and having a candid discussion with informed decisions based on data from our president and leadership team. The goal of this meeting is just to basically discuss that and decide as a board whether or not we want to move this discussion to a formal meeting on the August 19th meeting. So tonight we won't be deciding on the decision of the vaccine mandate or not. We will simply have the opportunity to vote yes or no to put this on the 19th agenda, in which case then we can again discuss whether or not we want to vote on a mandate or not. Is that clear for everybody? So we're hoping to have enough discussion tonight for us to decide on the 19th. So just so that we're clear, we're not deciding tonight on that. We're deciding tonight on formally putting this agenda item on the 19th. So with that, we were supposed to have Director Penson do the land acknowledgement. So she is not on.
Let's move to Michael so I can keep it in my head.
All right, Director Solano, do you have it with you to? You're on mute still. And I do want to appreciate the acknowledgement. Go ahead.
Or we can have you do it, Mohammed.
I can do it. That's fine. I want to first acknowledge and thank Director Saltzman, because I think this is the passion that you've shown to this issue, and we're all public servants. This is not our main job, and we're spending time to get to a situation where we are serving our constituents in our board. And so I appreciate you bringing this up in the last meeting and giving us the opportunity for us to discuss further. So thank you for that, and for the emails that you've sent with your efforts to help get this decision to move forward and discuss further. So thank you.
Thank you.
And with that, I'd like to start with the acknowledgement. Every community owes its existence and vitality to generations from around the world who contributed their hopes, dreams, and energy to making history, the history that led to this moment. Some were brought here against their will, some were drawn to leave their distant homes, and some have lived on this land for more generations than can be counted. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and differences. We began this effort with acknowledging what has been buried by honoring the truth. We are living on the ancestral lands of the Multnomah, Wasco, Kalwitz, Cathlamet, Clackamas, bands of the Chinook, Tualatin, Kalapuya, Molalla, and many other tribes who made their homes along the Columbia River, creating communities and summer encampments. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlements that bring us together here today. And please join us in uncovering such truths at any and all public events. And with that, I'd like to call for a motion for us to approve today's August 10th board agenda as published.
I so move. Michael moves.
Thank you, Michael.
Second.
Thank you, Dr. Saltzman. And any discussion around the agenda? Questions? Okay. Gloria,
Director Cremona Wagner.
Here.
Director- Thank you. Director Sunleitner,
Yes.
Director Bustle,
Aye.
Director Saltzman,
Aye.
Director Wilson,
Aye.
Chair Aliajuri.
aye. Thank you. The motion passes. All right, and I've given the framework of this meeting. Thank you all for listening to that. Again, we are the board of the PCC College, and we, as always, like to have full understanding of topics before we move to vote on them. And so this is another opportunity for us to do so. And we will hear from members of the community as well later on with testimony. So just keep in mind that's going to happen as well tonight. With that, I'd like to hand over to President Mitsui to walk us through the report that him and his team and other experts helped produce for us to have presented tonight.
Thank you, Chair Aliajuri. I assume that board members have already read this, so I'll stick to the highlights. And I'm just going to, I don't need to see it on the screen unless folks feel that they need to see it. I'll step through it with my own file. But just so that we can follow along together, starting with the introduction, did want to point out that we do have a survey out of returning and new students or prospective students, as well as students who have stopped out. I know there's been a question about the general applicability of the survey data to the larger student population. I do want to note that this was not a randomized sampling. And so it is not automatic that the survey results would apply to the larger student population. However, one bit of encouraging data that would suggest that it is that the demographic breakdowns are very similar. So, for example, African-American students comprise 4% of the student population, and they comprise 4% of the sample in the survey. So, and it's pretty consistent across all the demographic subgroups. So with that in mind, and also we had a pretty significant return rate and a pretty large sample population compared to the general student population. So with that in mind, what we noticed in the trends, first of all, the student population has a much higher full vaccination rate than the general population in the state. Across the state, the benchmark is one shot. Our benchmark was both shots. And so we were able to identify that as a conservative estimate, about 84% of current, returning, and new students will be fully vaccinated by fall quarter. 81.9% of returning students indicate they're fully vaccinated. So we are encouraged by that. I want to point out too, for some reason, there's a higher rate of full vaccination amongst returning students than around new prospective students. And there's a higher number of returning students by a pretty large factor, 20,800 compared to about 8,000 or so of prospective students. But there is a differential. And so I think that's of interest to note that returning students, for whatever reason, are more likely to be fully vaccinated. And I wonder if there's an educational impact there. So as we take a look at the students that are either unsure about vaccinations or unlikely to be vaccinated, I did want to bring your attention to the graph that was recently submitted and distributed to the board. And you should have received a table that identifies by race and ethnicity the breakdown of students that were unlikely to be vaccinated or unsure about vaccination. So for example, the Black or African-American response showed a 76.8% rate of already or likely to be vaccinated, but a 23.2% rate of responding as unlikely to be vaccinated or unsure, compared to the white population that had an 87.1% already or likely to be vaccinated rate and a 12.9% unlikely or unsure about vaccination. So roughly a 2-to-1 ratio of hesitancy or unlikeliness to be vaccinated. So that's part of the disparity that I mentioned at the last meeting that is of concern to us. I do want to point out that PCC administration is pro-vaccine. We believe in the COVID vaccine and we believe in vaccinations. And we are actively promoting and supporting COVID vaccinations in partnership with the Multnomah County Health Authority's Racial and Ethnic Approaches to Community Health Program, or REACH program. We also are in partnership with the Washington County Health Authority and Medical Treatment International in the Willow Creek Center by offering a vaccine clinic there. And again, with REACH and Multnomah County at the Cascade campus with a vaccine clinic there. And also tomorrow, we have a outreach and vaccine clinic at Southeast campus, again with MCHA and the REACH program and the Oregon Chinese Coalition. We'll be providing free vaccines, multilingual outreach, and $150 in incentives. So we will continue to provide and expand those opportunities in partnership with Oregon Health, OHSU, Oregon Health Sciences University. And we're talking, for example, about bringing multilingual health professionals in to our classrooms, into our campuses to speak with students. So as we go through the report, one of the key questions for the board, if the board decides to reverse the administrative decision and consider a vaccine mandate, is what is the primary purpose of the policy? What are we trying to achieve? So for example, what is the acceptable vaccination coverage rate? Right now, statewide, you're all pretty aware of the current vaccination rates. But with vaccination programs that have been around for a long time, the rate can be around 95% for 5 to 6 different vaccination programs, according to the Oregon Health Authority. However, non-medical exemptions run around 5%. And so in any program, you won't reach 100%. And so if we're talking about going from 84, 85% to 95%, then there will be some trade-offs that the board needs to be aware of. COVID procedures do need to be considered in a holistic way. So particularly with the Delta variant and the current PCC mask requirement, if that is needed to be continued, as the governor's recent order indicates, for indoor masking anyway, is there still a transmissibility need for vaccinations, at least as it relates to college activity? That's another important consideration. I do want to note that we have been operating in-person activities and classes. Summer quarter, while the Delta variant has been around, as well as spring quarter and winter. And when I last checked, we have not yet, knock on wood, had any documented transmission of COVID with the safety and health procedures. I do also want to indicate that our reopening, so to speak, of in-person offerings has been carefully calibrated to our capacity to maintain those safety and health standards. And so we've been pretty careful about maintaining those throughout the pandemic. We also need to think about if there's an educational motive or component to a mandate, and the potential disparate outcomes with a COVID vaccine mandate. So the basic elements of the report you've already seen. We've talked about the primary purpose, that the fact that PCC supports COVID vaccinations. We did apply, in addition to all the other analyses, a racial and social justice analysis using the PCC equity statement the board passed, and using the equity assessment tool that the board has received training on. We did take a look at community rates and disparities in vaccination rates. And you see those in the report, the 69.9% of white population having at least one vaccine dose as of August 1st versus only 50.3% of the Black population, or about a 19.6% differential, and 50.2% Latinx community, or 19.7% differential, as a issue of concern. And we do note that the health authorities are doubling down and with some amazing and strong efforts in partnership with culturally specific CBOs to reduce those disparities in vaccination rates. According to the Oregon Health Authority, in the community, though, there still are significant disparities. For example, well, you've seen the Oregon Health Authority figures already that would indicate the daily vaccination rate for the African American community in Multnomah County would need to increase tenfold in order to reach the goal of 80% vaccination by the end of August. So there are still some significant challenges in the community. So the relative efficacy of mandating versus not mandating vaccines in order to increase vaccination rates of community college students. Two key elements to consider there: universities have been mandating vaccines for a long time as part of being selective institutions. It's relatively rare that community colleges also mandate vaccines, in addition to having other admission requirements. So the infrastructure to do that, the orientation to do that, some of the business model reasoning to do that are embedded more in selective institutions. Community colleges traditionally have been open access institutions by philosophy and practice. And so this is new territory for us. With it, there are some infrastructural needs in terms of being able to apply a vaccine mandate. But that's not necessarily a reason to not do it. That's just an explanation of the reality. The impact of exemptions on vaccine compliance, I alluded to that earlier. We don't know if the current vaccine program coverage rates apply to COVID or not. And according to the Oregon Health Authority, MMR, DTaP, and other kinds of vaccination in K-12 rates hover around 95%. So we're not anywhere near that with the COVID vaccine. The K-12 system, as you know, has been doing this for a long time. We're talking about really children and parents as opposed to adults. And so that is parents determining whether or not a child is vaccinated. But the exemption rates have peaked recently. In 2021, they came down to about 5%. They got as high as 7% a couple of years ago. But in a conservative estimate, if we were to apply the same modeling to a COVID vaccine, would be at least a 5%. And so when we incorporate that into very cursory modeling of the potential impact of vaccine mandate on the actual vaccination exemptions and how it impacts the number of students who are not vaccinated and therefore disenrolled. It does show some interesting patterns But again, we need to be able to verify that data. So in short, gains could be made, and they could also be offset through, they could be made through a mandate, and they could be offset by exemptions. So it goes back to the purpose. What is the purpose, and who are you centering the policy on? Another question, are mandates going to be for students and employees as well as visitors? And is it going to apply for remote learning as well as in-person learning? And so about 75% of the courses are going to be online for fall quarter. And in addition to that, if we're talking about employees and students and visitors, there would be a whole set of procedures that would need to go with that. And I'll talk about employees in a minute. So if the underlying purpose is to minimize transmission of COVID in the workplace and also in the classroom, if 75% of classes are going to be remote or online, then does a mandate make sense for online and remote students? So some of the legal issues brought up in the report. One is that in the fall quarter enrollment has already started. It started in June. Over 20,000 students, 20,800 students are already enrolled. Going back and requiring enrolled students to provide proof of vaccination now could expose a college to a breach of contract claim. One possible mitigation strategy could be to provide tuition reimbursement to those students who are disenrolled due to a vaccine mandate. So that's one legal consideration. The other, if the mandate applies to employees, we will need to give notice to the unions, not just to the employees themselves, that PCC is considering a vaccine requirement and be prepared to bargain on demand from the union. My understanding is that there's a 90-day period for that, or window. PCC should also be aware of the potential consequences that accompany a mandatory vaccination program, such as compliance with American with Disabilities Act and Title VII of the Civil Rights Act. And PCC also will need to comply with federal, state, local law when requiring employees to be vaccinated, including the medical, religious, and philosophical exemptions and the avoidance of potential discriminatory enforcement of these exemptions. We should all be also aware of potential liability related to requiring vaccination when the FDA has yet to grant full approval for this vaccine. It's currently under emergency use authorization. And then, there will also be legal considerations regarding asking for and electronically storing student vaccination and employee vaccination information, and particularly around requests for vaccine exemptions. The same holds true for employees, including requirements of the Oregon Consumer Information Protection Act. And students who are also employees pose additional legal questions. There are additional logistical considerations that I'm not going to go through all of them, but this does require new infrastructure that will need to be developed. Whatever procedures we put into place, we want to make sure they run well. Otherwise, it's counterproductive to having the policy in the first place. We do have a very small student systems team and an equally lean team on the IT side, and they would need to be retasked in order to implement implement a vaccine mandate quickly. There also is the issue of general public and visitors to the campus, how vaccination status would be determined for them. We have a lot of open areas, a lot of shared space. For example, the Oregon Employment Department, childcare centers at our various locations, visitors and guests at our shared recreational facilities, and so forth. So, just wanted to cover that. First of all, see if there are any questions. And then my request to the board is, as you consider this, that if there is a decision to move toward a mandate, that there be a very clear definition of a primary purpose. But that we can come to later after discussion. So I'll stop there, see if there are any questions, comments.
Director Salzman.
Thank you, Chair Aliajuri. So the survey information that you're quoting is from the PCC employee survey and
No.
PCC community survey?
No, it's
Okay.
it's from the survey of students.
So not from the employee survey.
Correct.
And when was the survey of students done?
We've had two. I can get the dates for you. The survey, the most recent survey of students, I believe, was about a week and a half ago.
Well, I guess I want to just point out in the student survey, the reopening survey, which had 3,200 responses, and then the employee survey, which had about 1,200 responses. To the question, how important is it for you that most people are fully vaccinated at PCC before returning to campus, fall term 2021? 77% was very important to the employees, and the students are 75%. So, and this was all pre-Delta variant. So I would imagine those percentages have gone up even more. So what is the purpose of mandating vaccines? To me, it's really very simple. It's to save lives, particularly among young children of our students and of our employees. That's what it's about. Young children are the fastest growing infected population right now. And I think the board really has to look at this from two perspectives. And I think that's our responsibility. The first perspective is the public health of our students and our employees. I think we have a moral responsibility to adopt a strategy that has the greatest likelihood of protecting them from COVID infection. And then the second perspective I think we need to employ is the global perspective. That if we're ever going to get on top of this pandemic or reduce it to where it's a measles vaccine, we have to lean into it. Lane Community College last month chose to lean into it. They grappled with all the questions you raised and they did it. The question for us is, are we going to lean into this by having a vaccine mandate policy that will save lives of students, employees, and their young children? So that's the purpose to me.
Thank you, Dan. Director Bussell.
Thank you. I have plenty of comments, but first I just have a question to clarify. So thank you for your presentation, President Mitsui. I went back and was looking through my email, about the percentages that you were mentioning, and I found one attachment with the disaggregated vaccination rates. And so it just had two pages with the same data, but one page, the first page showed a question of how likely is it you'll be fully vaccinated before classes start, and 5,000 people responded. And, the average, I'd say already vaccination rate is somewhere around 80, 85%. But then you were listing some other disparities. Where were those disparities from?
So if you look at the African-American responses and then take a look at the columns that say unsure and another column says unlikely, you add those two together. For the African-American students, it's about 23%. And then when you look at the white student column and look at the same unlikely and unsure, and then add those together. I don't have it open, but I think it equals around maybe 12%, somewhere around there.
Okay. So regardless, the percentage of folks who said they are likely to get a vaccine is still somewhere in the like 70+%, right? Okay. And then of course there's no, so I guess I just want to highlight that. I'm not sure exactly what my next thought is, and so I'll stop talking, but I do just want to highlight that, although we haven't mandated it, one thing, and so we have no way to then enforce at this very moment to then verify that those numbers are in fact true. It does suggest, though, that a high number of folks are in favor of getting a vaccine, want to be vaccinated, see the benefit of it, will be, hopefully getting vaccinated. And then I guess for me, then it begs the question of how do we meet people where they are to get that other 20% of folks who are unsure educated with the correct information and also hopefully vaccinated. So I just want to say that, and then I'll stop talking.
Thank you, sir. And I think, it's a valid question. Both, I think I agree with Director Salzman. It's a moral obligation for us to enact in the public health frame of mind, which we have been doing since day one, more than anybody, I would argue, utilizing all the experts and reports and all the mandates or the distancing and masking. And now the governor's mandate for masking is going to reinforce that once again. And then to your point, Soren, I think people are heading towards that direction. I was mentioning to President Mitsui a while back that within our OHSU workforce, it went down from 40% unvaccinated to 10% just in the last month because of information. Delta variant has alarmed everyone, but also just the access to vaccines is increased and whatnot. And so it's a tough argument. I appreciate everyone struggling with this and grappling with this. And just to your point, sir, and I think it's a good point you made, we're clarifying, we're not reversing a decision, we're still deciding on implementing a mandate versus not. And so thank you for pointing that out. Dan, go ahead.
Yeah, in terms of the racial disparities, I'm a little confused. In the memo I sent to all of you, I included a table from the Oregon Health Authority dated August 1st. And that shows the disparity in terms of people who've actually been vaccinated in Multnomah County between whites and blacks of about 12%, and in Washington County about 10%. So that's a lot lower. And I guess the other point, and as I said in my memo, is, thanks to the hard work of health departments, community organizations, that disparity is going away. In fact, the OHA director said, not last week, but the week before last, that the black rate of vaccination is running at a 2% greater rate than that of whites. So I don't see the disparity. The numbers that the president used seem much larger than what I'm seeing in OHA data and hearing from OHA director.
Chair Allegri, can I respond?
Yes, and then after that, I'll go to Director Corona Wagner. Go ahead.
Yes, Director Saltzman, I saw that you pointed that out in an email. So we went back and checked and went to the same website, Oregon Health Authority, confirmed the date of August 1st. And the fact, so and I included the link in the report. And if you click on the link in the report, you will see the histograms, the bars that show, that line up with the numbers that I provided in the report. So I don't know if you had an opportunity to do that, but we were concerned when we saw your email, so we went back and double checked, and the numbers that are put in the report have been confirmed.
So you're confirming the same numbers I'm using from the OHA with the OHA?
No.
Where
No.
are you confirming your numbers from?
The link that's in the report, if you click on that, if you have the electronic
link.
copy,
Well, there's several links here. So which,
it's in the equity section, I believe. But there's a link there. It goes to the Oregon Health Authority breakdown by county. And it shows the percentages of one shot, not two, but one shot for COVID vaccine disaggregated by race.
Is that on page 11, Mark?
Okay, sorry, I'm gonna have to switch screens. It is on page 5.
Okay, Lori, do you want to go ahead?
Yes, thank you. I'm wondering if we can see the breakdown between already vaccinated and likely to be vaccinated. And the follow-up question to that would be, did we gain any insight into whether a mandate through this survey? Was the question asked, would you be more likely to get vaccinated? If you are likely to be vaccinated, would you be more likely to be vaccinated and get the vaccination if there were a mandate versus if there weren't, so that we had some insight as to what the impact of the mandate would be? Or did we also conversely ask, if there was a mandate, would you therefore not attend? What would the impact be?
Yes, no, we did not ask those questions, and those would be good questions to ask.
Do you have the data on the breakdown between already vaccinated and likely to be vaccinated? Because I think combining those would help us understand maybe if those people that were likely to be vaccinated would get vaccinated because they actually needed to.
Yes, let's see. I would need to get the original table, but we can get you that information.
Yeah, Mark, this is Heather. I'm happy to find that, and I was trying to see if I could get it really quick. I can try to pull that as quickly as I can and get it to you.
Thank you, Heather. That'd be great.
Okay, Mark, in terms of the impact, would there be a timeline that's already, I guess, theoretically talked about for making this mandate, if that was the case? And what does that look like?
Well, I think that we would be more likely to be able to implement well if we had a winter quarter timeline. The fall quarter, again, registration we're quite a ways through it already. And then only about 25% of course offerings are going to be on campus. So we're going to mask, more than likely, we're going to mask anyway. And 85% of the students are already fully vaccinated. So I think that if the board wanted a mandate, that it makes sense to do it right and to do it well. One of the things, yes, Lane is leaning into this, and we're much bigger than Lane. We are still the largest higher education institution, serving the greatest number of students of any 2- or 4-year institution in the state. So there are some realities that we need to work through when it comes to systems and setting them up. And it is true, and I just want to provide the board full disclosure that there are a lot of important factors to consider when we are implementing a new system in a large institution in order to implement something well and implement something we've never done before. So just a note there that it would take time. So I did just go back and looked at the link, Director Saltzman, and it has changed. The white vaccination rate has gone up to 75%, and the Black African American vaccination rate is still 19% lower.
Thank you. Director Russell, you have your hand raised?
Yeah, thank you. Another question. Are there other vaccines that PCC currently mandates, like meningitis or?
No, not for the general student population. Sometimes our healthcare programs have to get vaccinated to do their clinicals or to have other field experiences.
Clarification, President Misui, when you were talking about take time to do this right, were you talking about fall or winter? The
Winter.
Winter, okay, got it. So that could be the potentially a topic of our August 19th meeting is thoughts around winter.
Well, there's no timeline attached to it, but the August 19th would be a mandate, and it could have some details around it, and that could be certainly part of it is by when, and if that's attached to the resolution, that would be discussed as well before then.
When does winter quarter begin?
In January,
January.
but enrollment starts a few months before then.
Mark, I'm not sure if you know the answer to this, but is there a threshold or a critical mass, critical point at which where you decide to do this mandate by winter or spring or whatever, we get to a percentage where it becomes unnecessary? I mean, it's one thing to do it when, 6 months ago versus now that we're getting closer to that percent of willingness and also vaccination rate.
Right. I do think the 84% is conservative because we're not all the way through enrollment. The two surveys were done a couple of weeks apart, and they've been fairly consistent. And so the survey results do not seem to be as dependent on the N. So as the N has, in some surveys, as the N grows, as the sample population grows, your results change. We haven't seen the same large effect. So it's possible that we will see some slight increase or maybe a little bit more than slight in the vaccination rate. So again, the question is how high of a rate is acceptable, knowing that students and employees will claim exemptions, and you'll never get to 100%. You're required by law. I do want to go back to the timeline. And again, another consideration will be bargaining. And we do need to notify the unions. There's a 90-day bargaining window as well.
So the surveys were done online, I assume? Okay, I guess I respectfully disagree that the 85% is a conservative number. It's well known that people, not all people, but some people, when they're polled, tend to say what they think the pollster wants to hear. And on this issue in particular, people will tend to say they're vaccinated because they think that's the right answer. And that gets people off their back. So I think 85% as a conservative number is wrong.
Director Wilson?
Yeah, I am just learning so much about the world of vaccinations. I do appreciate the presentation and now the awareness, and this conversation will help with my conversations with others that are coming to me and ask like how we got to this decision, and really challenging us all to kind of formulate, what we value or believe as individuals, and then how that reflects on our guidance and support of the college. Curiosity question. I think I know the answer, and I don't know if I missed this, but why doesn't PCC currently require vaccinations?
No, that's a good question. And so So, it does go back to the different contexts for universities and community colleges. And, we don't have residence halls, for example, where certain diseases are communicable and easily transmissible. We don't have large athletic events, big D1 football games, for example. We don't have large lecture halls filled with students in close proximity for a long period of time. And so universities have gotten used to mandating vaccines. Our students' average age is 28. They get off work. They come to class if they come to class, or they log on. They participate in class. Some participate in other activities. Most go home and take care of the family and come back after work the next day. So it's a very different context. We've not had, to my knowledge, a need for that. I mean, we've not had major outbreaks before. So it's not been part, and this is true for community colleges all across the country. The vast majority of community colleges, 1,100 community colleges, have never and do not require vaccines and are not requiring the COVID vaccine. I do think, I don't know why our students would mislead us on a survey. I can't wrap my head around that, knowing our students. And if it were a mandate, if we're talking about a mandate, I think then students might say, oh, I'm already vaccinated. But I don't get the sense that, and maybe Molson can, I don't want to put you on the spot, but I don't know if you can provide any insight. But I don't get the sense that students would try to tell us what we want to hear. They usually don't tell us what we want to hear.
I'm just saying that is a general rule of polling, though. I mean, that's all.
This isn't a poll. This is a survey, and I understand the point of response bias. I would say it's way more likely that there would be response bias than that someone would answer untruthfully. And therefore, it would be good to understand to how many people this survey was actually sent, because it could have been that those people that were vaccinated were more likely to respond than that they would answer untruthfully.
And Mark, I'm sorry if this is mentioned earlier in previous meetings, but with respect to faculty and staff, do we have a sense of the likelihood of getting the vaccine if it was mandated or not? I know we're not surveying the staff right now, but do we have a sense of what that would look like?
I'm sorry I don't have that report open. I don't know, Heather, if you've got access to that, but yes, there is an employee survey as well. I don't want to misquote, but we do have response. If my memory is accurate, it's always dangerous to rely on my memory. But I think there were very similar response rates in terms of likelihood to be vaccinated. I see Michael nodding.
Yeah, they were. I'm trying to find that one too. That one was from spring, so it was from May, and that's when we sent out the employee survey along with a student survey. So I can look for that, but it was right around mid-80s as well then. But I can try to find that. It's copied in your report. It's in the appendix at the end of the report as well.
Thank you. I guess I was hoping for like a current one based on a lot's happened since May, but it probably will reflect the same rates as a student as far as not changing drastically, I'm assuming.
Yeah, I think it's a brand new world in terms of May data. I mean, that's like ancient history by now in terms of the Delta variant. But the survey did say 77% of students say it's important that most people are fully vaccinated before returning to campus in fall 2021. That's what it says.
Mm-hmm. Yep.
But as you said, that was done in May. I bet that number would be far higher now with the Delta variant.
Actually,
I think-
there's a link at the end, I'm just realizing, to Heather's point, that takes you into the survey results for May versus August. So you can actually see, Heather, is that right? You can actually see the difference there. You can see the total number surveyed. It was sent on July 27th, 8,240, 5.6% response rate. So you can actually see the breakdown of the data between the two surveys.
Yeah, the only problem is the student to student comparison. Exactly. You can get a comparison of those rates. We do not have an updated employee survey to compare back to spring, but you're absolutely right. The student to student was pretty consistent in terms of the intended vaccination rate and already vaccinated rate.
I also think everyone would answer it is important. I think it's just different question as to would that prevent you from coming to campus if you had to be forced to get vaccinated versus not. And so I'm struggling with that piece as to we're doing everything we can, safety and health measures. And if that's good enough for most folks to continue their education, and adding that factor of now requiring it with possibly not getting a full accurate representation of that, even with a mandate, what is the impact of that? And that's what we're deciding, I guess.
Yeah,
The same.
You had mentioned whether this would apply to students who are doing online learning only. I would not envision our policy applying to students who are not on campus.
Okay.
And that's what Lane Community College did as well.
The other thing I'm
I
seeing
think,
here to end. Oh, sorry, Tiffany, go ahead.
I think we take a risk, just like you're finding in any other organization. If you're requiring mandating people to get vaccinated, of them not coming to school. So I think that is just the risk. That is the big question, and not just our organization, but all organizations that is considering mandating this vaccination. So that's where there is the mandate or get tested weekly or whatever, but we are taking that risk that students will say, no, well, then I'm just not coming. So we can't overlook that. We also, sorry for being late, there was other things going on, but we can't overlook that. And we also have to ask ourselves too, in all honesty, who are we doing this for? What's the end game here? Like, we got to be clear on that. And also, does that mean that we're not going to have I think we should also, we're not going to require mask and social distancing. And also, there's another thing, things are changing. People that are vaccinated still are able to get and carry the virus. So it's got to add up, you guys. And I mean, I just want to make sure that we are uncovering every rock before we're sitting here telling people what you have to do, especially as it relates to what your health decisions and what you put in your body, and it not being FDA approved, and then it coming out that people that are vaccinated are still able to have and carry. And then, I mean, the list goes on. So when you think about policy, what I always have to remind myself, don't necessarily think about what I want to see, but think about if we do a policy like this, then what's next when the next thing comes. So that's where I'm going to stand with this. This is an interesting one, and everybody is trying to solve this very issue. But I'm going to be real honest too. The people that are at the top that are saying mandate are not the people that may feel funny about it or on the fence or historical, don't trust it or want to wait. They don't look the same, and they're not from the same background. So let's just have the real conversation. And then the conversation, you have a conversation, the big push, oh, the Black, Indigenous people of color. And when this first came out, the coronavirus, they talked about, oh, the impacts on Blacks and people of color, but then they didn't even provide access to the vaccine for us and make it easily accessible. Now that you keep that in general, you got to get over the hump. We're not at where they want to see with vaccinations. Now they want to put pressure on the Black, Indigenous, and people of color to get us over the hump. So we've got to have the real conversation. And then there is even with the media focusing on Black, Indigenous, people of color, that's creating already a stress. Like, I'm gonna just speak for myself because I'm Black. Like, oh, because this is our fault now? Now we got to get you over the hump. But when you said it was more important for us to have it, we didn't even get it at first. So look, this is a tricky thing. And this is something we really need to really think about. And regardless, we need a mask mandate. Everybody is able to spread this, vaccinated or not vaccinated. And I feel like another thing, everything is done so rushed. Everything is just like, oh, we need to, oh, this, oh, that. And it's just, as you see, things are changing so much. We need to sit back and take our time and really think about this. That's what we need to do. So that's just, I'm going to stop there. Mohsen, I think you were going to speak.
We'll go with Mohsen, and then Surin had her hand up too. Go ahead, Mohsen.
I wanted to just reply to a previous comment about the survey's reliability. Well, I don't really think students would falsify their answers just for this. I mean, it concerns their health and welfare. So, and also it's an anonymous survey, which makes it more reliable compared to if you were actually asking the person in front, like then they would be more likely to give you a different answer. Furthermore, I agree with Director Benson's comments about accessibility. I think that we should focus more on vaccine education and accessibility and provide that. And if the mandate does come into effect, then students would just stay home. That doesn't really solve the problem. Like if we educate them more into getting the vaccine and why it's required, that helps them more and actually helps them make the decision. And as President Mitsui said, that there are multilingual speakers coming who are going to come and speak to the students. So I think that's a great initiative that will actually help and educate the students to provide that.
Thank you, Mohsen. And just to add, sorry, Surin and Michael, I'm going to add one comment really quick, just to add to Tiffany's, to your point about the next thing in our policy decision-making. I think as long as we stick to what we've been doing, informed decisions, I would add maybe more discussions around these hugely sensitive topics, more data. We should be able to come to the same conclusions based on the data at the time of the situation. So I think we shouldn't take this and apply this template to the next thing. I think as long as we utilize our methods the same way consistently every time, it should be hopefully more reflective of our decisions then. So thank you for pointing that out. It's not going to be the only issue that we have to face that's polarizing for our students, our faculty, and our community and our board. So we'll go with Director Bussell and then Sunliner. Sorry, Dan.
I speak too much. I was just putting my hand up because I had noticed Mohsen had their hand
Oh,
up.
thank you.
Thank you.
Thank you for that. All right, Director Sunliner and then Director Saltzman.
I've been listening, and of course I've been reading. I wanted to first really express appreciation for Dan Saltzman's sharing information with us and the passion with which he expresses himself. I would have to say that I don't think anyone on this call does not want to save lives. And I think we're all into saving lives. We're all into protecting young children, particularly those who have not had access to any vaccine yet, including my 6-year-old grandson, for example. We all are concerned about the public health of students and employees. The question is not whether we're concerned, it's how we should express that concern. What policy makes sense in this particular time? I wanted to also really express appreciation for the report, 13 pages long, which I've read 3 times now. I'm glad that Mark didn't have to read it a 4th time. That would taken a while here. It's, I think, a great deal of thought, and 125 hours has been put into the current policy. And it's not anti-vaccine. To some extent, and this is where I can maybe add a little bit, I think the discussion is often being sidetracked by kind of a binary, well, you either mandate or you don't. You're either against the vaccines or you're for them. You're either for saving lives or, you're like those pro-choice abortionists. I mean, there's this kind of binary way of looking at things that I find very disturbing. And I'd like to push back against everyone who has that. When it boils down to it, I think Mohsin and Tiffany best expressed my concerns. And my concern maybe is a little different in that I'm not, number one, concerned about the equity issue. Equity is one of a number of issues that are very important to me. For me, the most compelling reality is the pragmatic one. How would we implement a required mandated vaccine? At what cost? Now, there would certainly be a tremendous cost to staff time, disruption, short timelines, mistakes likely made. Let's say a miracle happens and we manage to pull that all off. Well, there is still a voluntary element. I spoke to Travis Nelson. Actually, he spoke to me. He's probably listening in on this call. He was lobbying me to have a required mandate. He is, I believe, the upcoming, if not present, vice president for the Oregon Nurses Association. We had a good, long, one-on-one, 30-minute conversation at least. And I came down to it, well, Travis and others, what about Mark Mitsui's reality check? We're a community college, we're not a university. We haven't been requiring records. We don't have an infrastructure to implement requiring the showing of cards. We'd have to backlog that to those who have already registered for fall classes. There's so many pragmatic issues here, and our lack of capacity combined with the reality that we're going to have most everyone on campus choosing to be vaccinated anyway, and the reality that there's a disproportionate, this is the equity issue, but it is a straw on my camel's back. It's not maybe the primary argument, but it's a very important one, where we might increase the disparity between white and non-white peoples as they apply to be in classes here in the fall. We might increase then the disparity of effective access, thereby rippling to increase the disparity between those categories of people when it comes to completion. That is an important consideration. And I don't think it's necessary for us to, at this time and place, to require a vaccine. that could change rapidly. The Lambda variant coming up from Peru has already wreaked havoc there. And I've been following that for over a month, mostly in international media. There will likely be another variant popping out of Africa where 2% of the population is vaccinated and the world doesn't seem to care about providing vaccines for them. There are all sorts of things that could happen that would make our current vaccines kind of irrelevant and would be back in a crisis mode. But at this moment in time, as we approach 70 or 80% of the people coming to PCC in the fall being vaccinated, as most of our instruction is still remote until the winter term. As I, for one, do not want to increase the disparity of applications, access, and by rippling effect completion based upon race, you're being white and non-white. All of those combined, as well as legal considerations, which are for me lower down on the list, Mark, but they still deserve to be there, compel me to hold firm to the current policy as announced by the administration. I do wish that we had had these conversations 2 months ago. I think part of our binary problem in terms of process is kind of a too clear separation of board policy and administrative policy. I think when it affects quality of education, which is a board policy, there's an overlapping when it comes to many administrative policies that deserve at least consultation. And we have not been in the loop. And part of this conversation we're having now is the consequences of us not being in the loop. But now that I feel I'm in the loop and I have a 13-page report and it's full of very, very logical reasons why the administration policy was announced as it is, I am unconvinced that we should change it at this point. It would take some convincing for me to say that we should change it for winter term, because I think by then, either we'll have a dramatically increased percentage of vaccinations and the gap between white and non-white vaccinated will be much less, or there will be a crazy new variant that will throw us all for a loop. I'm sounding a little binary myself, but I really think that we should hold the course. And I appreciate Mark for all the effort that was put into the 13-page report. Thank you.
Thank you, Michael. And I just want to acknowledge one thing. I think Director Saltzman, he's coming from an informed decision as well with the we know vaccines prevent the spread. No one's denying that. I think this is an issue of access to our specific populations that we're serving. It's also acknowledging we're taking more extreme measures in most places to prevent the spread in our own way based on expert knowledge and data as well. And we're headed towards the direction we want to anyway with the vaccine mandate. I mean, with having to have people vaccinate on their own. So I think it's a really good argument on both sides, but this is an issue of access, not preventing the spread, because we're doing that already in our own ways with the 20% on campus, the masking, the distancing, and the current high rate of vaccinations is definitely getting us there. So thank you, Michael, for that summary. We are coming up on time. Do we have Dr. Salzman? Go ahead.
Yeah, well, I disagree that we should be complacent about this, or that we should further discuss, analyze, debate. The Delta variant is wreaking havoc upon us, has wreaking havoc most upon children under 12, sons and daughters of our employees and our students. So there is a sense of urgency to me. That is the fastest growing rate of COVID-19 infections in the United States right now. So there's a real sense of urgency to me about having a mandate. And yes, a mandate I believe will save lives, but it will also compel people to make a hard choice about getting a vaccination or giving up their job or giving up in-person learning for remote learning. Yeah, it will make people make those hard choices. But I believe we have an obligation, a moral obligation, to embrace this and to do it. And I'm hoping to bring a resolution to the meeting on the 19th that would do this.
Director Penson.
There's no room for wait and sees.
Thank you, Dr. Saltzman. Go ahead, Tiffany.
So Dan, I respect where you're coming from and I get it. But there's one thing that you just said makes me not want to cross this. When you said people have to make choices between being educated or their jobs. Do you think those people are going to more look like you or me? Do you think those people are going to be at the probably the lower income threshold or at the middle or upper income threshold? Do you think that keeping access to education and people and their jobs allows for people to become more informed and to make more educated choices or just their own choices? Don't you think there's some benefit in that? The fact that people should have to choose between putting food on their table and having access to education because they are, for whatever reason, because that they don't want it, because they're not comfortable, they haven't had access, they haven't had enough information. It could be religious, it could be health-wise. That is the problem.
Well, my response is, we didn't create this situation. We're the leaders charged with responding to it. And let's lead. I don't know who's going to make a choice about a job versus a vaccine. I think most,
well, I'm going to let you know. People that are probably not comfortable, people that have their reasons health-wise, people that the fact that people are like, I don't know, that I like saying, oh, well, it's not FDA approved. There could be a number of reasons that make people say, hey, I'm just not doing this.
Well, and we provide for medical exemptions and non-medical exemptions. That's part of state law.
I'm just gonna throw that out. I think we're having a good, healthy, robust conversation, but I also think it's the typical top-down conversation where we know what's best for you. We have to allow people to understand and make their own decisions, especially as it relates to their health. I do, but I strongly believe that we need a mask mandate and a social distancing plan, because the last reports I knew, people that are vaccinated are getting and spreading COVID too. So what's your answer to that? I mean, that's all I'm saying.
My answer to that is, that's why you've got to work hard to keep unvaccinated people out of vaccinated populations.
So
because
unvaccinated people are
people
giving vaccinated people COVID.
They are getting COVID, and they're coming home and they're giving it to their children. Is that not an important concern for you? That young children under 12
See, but the fact, so
are getting infected?
Here's where the issue is, Dan, that you ask that question as if I don't value the health of my community and everybody in it as much as you do. That's the issue with this. Just because people are still on the fence about vaccination or whatever, it doesn't mean that the people that are vaccinated, or I'm just, you know what, because we're having a real conversation right now, or the white people that sit at the top, like our people value the community's health less than you do. That I'm just trying to give you both sides. I respect your opinion. I respect everybody on here, but we've got to have two sides to this coin conversation.
I just don't
And
see.
all I see, and all I see right now is like, hey, we don't even know how we're gonna get everybody vaccinated. We don't know even how we're gonna check all these different things. And it's like, everybody put your mask on and social distance for now, and let's figure this out. That's just how I feel. And I'm leery about making policy that says you've got to put something that's approved only for emergency use. That seems not to be doing its job all the way yet either in your body. And I'm also more concerned about people thinking it's okay to ask people, hey, are you vaxxed? Hey, do you ask people, hey, you got sugar? Hey, you got the pressure? I mean, no. That's how I feel.
Thank you, Tiffany. Thank you, Dr. Salzman. I'm gonna try to wrap this up. We have a list of folks who want to give testimony, but quick point of order question. Jeannie, do you want me to have the motion now or after the testimonies?
It would have to be after the testimony because this is an agenda item and you're supposed
Okay.
to public testimony first.
Thank you. Because in other meetings, we usually reverse it, but that's fine. Thank you.
Well, I was told this was a work session and there was no public testimony.
So this was a special session.
In the notice, it said no public testimony.
That is for the board retreat on Saturday.
Oh, did I miss
Yeah,
it?
we don't, it's, and by the way, the testimonies are not all related to this topic. So this
I
is
don't
why.
mind testimony,
Yeah.
but
Yeah.
I just thought that was not the ground rule. I don't mind it.
I didn't find out till recently too that we had testimony. So that's good that we're all on the same page now. All right. So with that, thank you all. I mean, and after the testimony, we'll have just a few more minutes to wrap it up. And then I think, like I mentioned at the beginning of the meeting, we'll put it to a vote if whether or not we want to stay the course or put this topic for a resolution on the August 19th meeting. So just so we all know the next steps after the testimony. And
Question.
oh, go ahead. Go ahead.
Is the winter mandate up for discussion as well, or just feel like we need a longer term view here? We're getting, like Tiffany said, we're just starting to get really rushed.
Well, so for the 19th resolution, we can include that on there. Certainly, I don't know. We haven't really had it discussed as an actual tangible thing on there, but we can discuss that too. I'm not sure. Mark, do we have, will we have time today or at the meeting to add that piece to it as a timeline? Would your team be ready for a timeline to be included in the resolution or not for the 19th?
Well, I think the first decision point that we had talked about at the last meeting was first decide whether or not to have a mandate, to reverse the current decision and have a mandate. And then the second piece, if the board votes to move forward with discussion on a mandate, would be to incorporate different timelines, different procedures and so forth. But the first decision point was whether or not to alter the current approach.
I guess that was my question is if we decide to have a mandate on the 19th, we don't have to put the timeline then. We can discuss it further and add it post. Okay. Thank you. Does that help answer your question, Lori?
Thank you. Yes.
Thank you. Okay. We have a few folks who have signed up to give testimonies. So again, I will remind folks that you have 2 minutes only to make your testimony. So please be mindful of time. I'm going to have a stopwatch next to me as well. And we'll start with, please include your, I guess I can repeat, I can have their names. Jeannie, you have it. Thank you for listing them. Please include your name and your relationship to the college before making your comment. And we'll start with Michael Trigobov.
And just as a note, when we're pulling people in for public comment, you will need to unmute yourself and bring yourself on video. Thank you.
Okay.
Go ahead, sir.
Hello, everybody. My name is Michael Triggerbuff. I am a part-time instructor in the computer science department and I'll read my statement to you. The first priority of this college should be to ensure the safety and health of its students, faculty, and staff. By not requiring a COVID vaccine, the college is instead prioritizing the unscientific hesitancies of those who choose not to be vaccinated. The college claims to be doing this in part to promote equity, but this position is fundamentally inequitable to those who will be placed at risk by this policy. People who are immune compromised and older people like me, whose immune systems are not as responsive to the vaccines. Vaccinated people can get breakthrough infections with Delta. This is less likely than unvaccinated people becoming infected, but it can still happen. The breakthrough infections may not last as long as an infection in someone who is unvaccinated. While a breakthrough infection is going on, that vaccinated person will be just as infectious as an unvaccinated person who is ill with COVID. By requiring everyone on campus to be vaccinated, we will significantly reduce the potential number of infectious people spreading the virus. Refusing to do that puts us all significantly more at risk for being infected with COVID, for suffering what might be permanent long hauler symptoms, and for losing our lives. The college has an obligation to make it as safe as possible for those of us who are willing to go back to teaching and learning in person. Making it safe includes a number of things: increasing the ventilation in classrooms to current public health standards, marking out appropriate social distancing spaces, and requiring masks to be worn by everyone on campus. Making it safe also includes requiring everyone on campus to be fully vaccinated so that we have the fewest possible number of infectious people walking around on campus spewing virus and causing other people to be infected.
Thank you, Michael.
Thanks.
Thank you. Thank you so much. And I'm sorry for mispronouncing your name earlier.
Oh, no problem. Everybody does.
All right. Can we have Candace Kling, please?
Thank you for the opportunity to speak tonight. I'm Candace Kling and I've been teaching at PCC since 1992. I'm here tonight because in spite of attending many listening sessions throughout the spring, in which I and other colleagues asked the college to mandate COVID vaccinations, except of course for medical and religious exceptions, the college chose to go the other way. Students, faculty, and staff are scared to return to PCC without mandatory vaccinations. I was talking to a neighbor whose daughter just graduated from high school. She had been planning to attend PCC for her first year or two until she learned we aren't requiring COVID vaccinations. Rather than risking her life, she has chosen to attend PSU. The thing is, her family can afford to do so. This is a real equity issue that the college may be overlooking. Instead, the college is using equity as a reason for not requiring vaccines, when in fact they're putting these at-risk populations at even more risk. Requiring mandatory vaccines is the best way to protect our students, faculty, and staff. The poll the college sent out in the spring is not valid because it didn't go out to all of the students that we've lost due to lack of success in the remote environment and did not have a large enough sample size to provide any meaningful data. The most recent surveys invalidated because while it was running, Dr. Mitsui's July 28th email about his feelings about vaccine mandates being barriers for our students and not inclusive was sent out to everyone while the survey was open. The response rate was also too low for this one. In closing, PCC leaders claim to be all about equity and inclusion, but leaders are choosing to keep most classes remote when students who struggle would most benefit from face-to-face. To not require vaccines, which will put everyone at risk, but will have an increased impact for long COVID and death in the communities with the least ability to afford healthcare. To make these decisions with a token faculty member, instead of having real and meaningful representation of faculty, students, APs, and classified, who are considerably more aware of student needs than the top level administration. To put PCC at increased financial risk from losing even more students to PSU and others who are opening, and to risk possible loss to programs and disciplines who have been hardest hit while having a total lack of support for these departments. PCC could be a leader, could actually help those they claim to represent, could help end the pandemic, could have an active education program to combat false information, could have real inclusion of non-admin.
Thank you, Candace. I'm sorry, your time is up. Thank you for your comments. Can we go ahead and have Leora Troper, please?
I do not see Leora in our participant list. So if you are here, could you please rename yourself and raise your hand so we can bring you forward? Mohammed, I'm going to go ahead and move on for right now. So we'll have Simon up next.
Thank you. Simon, please go ahead. Is Simon Jaworski on?
He's joining right now.
Okay.
Okay, good. Yes, my name is Simon. I'm a student. And yeah, I believe in vaccinations, but my main point of testimony is that I'm very, very apprehensive about them opening up the college for students in the fall, you know, with all the variants coming out and several people being unvaccinated. I think it's a really unsafe environment for people, for the college to reopen to students in the fall for on-campus learning. I, for one, have benefited from Zoom classes, and I feel like I've learned even more because I don't spend time traveling. You know, I spend, you know, I have more time to do labs with my lab partner. So no, I think we should hold off reopening the college until the end of next summer, you know, just to be sure, because they haven't, President Biden hasn't gotten anywhere near the vaccination rate he wanted to. And, you know, it's, I think it's just awfully premature to just be, you know, opening up the school so soon like this, you know, and spreading the virus around. So I think we should, you know, a lot of students like Zoom. I'm doing really great. I'd like to finish my degree on Zoom. So I think, you know, we should just keep the college closed through next summer. Thank you.
Thank you so much, Simon. Laura Feldman, you're on next.
Yes, my name's Laura Feldman. I've been teaching physics at Rock Creek for 23 years. And as I've been sitting here listening tonight, I've been wondering how many of you might have had COVID and how many of you may have had COVID because you were exposed at PCC, because that is what happened to me. I contracted COVID in my classroom just before the shutdown. I know that COVID was present in my classroom since one of my students, a 21-year-old young man, actually died of a pulmonary embolism, a complication of COVID, several weeks later. He had been employed at a senior care facility, one of the known early COVID hotspots. I was more fortunate. I only became a COVID long hauler, sleeping 14 to 16 hours a day for 10 months, suffering daily migraines, severe depression, and a host of other symptoms too numerous and unsavory to mention here. Vaccination helped somewhat, but I don't know if I'll ever be 100% again. At this point, I'm considering early retirement as soon as it becomes an option for me. It is clear that if we return to in-person instruction without requiring students and staff to be vaccinated, numerous others will become infected, suffer long-term disabilities, and yes, some will die. These will include not only our staff and students, but also those they bring COVID home to. It seems absolutely unconscionable to me that we would forego a vaccine requirement to avoid discomfort among specific populations in our community. I can tell you plenty about discomfort, and it has absolutely nothing to do with getting vaccinated. Thank you for your time.
Thank you so much, Laura. Can we have Robert Victorino?
Board members, my name is Robert Victorino. I have been an AP in the Emergency Medical Services program for 13 years and a paramedic for almost 20 years. While I can only speak about my program, I suspect that these struggles are not uncommon. I have 3 points that I hope you'll consider when you're discussing our evolving reopening plan. First is students. We have more student applicants for the EMT program for the fall term than we have been allowed space for under the current opening restrictions. Oregonians are stepping up to fight this battle, yet they can't get the training they need at PCC. We train more EMTs than any other institution in the state. It is our duty to educate these future healthcare providers. Many of these students plan to work or volunteer as EMTs and firefighters and begin their AAS in paramedicine immediately after finishing EMT training. They have a plan, they know the risks, and have accepted the responsibilities that come with being a first responder. It is our responsibility to provide these people of action with a jumping off point for their goals. 2 is our industry partners. As a currently practicing paramedic that has been responding to 911 calls throughout the pandemic, let me say that we are exhausted. Last week, a PCC paramedic alum told me, everyone who could retire did. We can't find enough people. This means that when you call 911 because you're experiencing a healthcare crisis, the ambulance team that shows up may be stretched to the breaking point. Local emergency services agencies are so strapped for people that some are offering hiring bonuses in the tens of thousands of dollars. 3 is staff. Everyone who could retire did. We can't find enough people either. Those that are qualified to teach EMTs and paramedics are exhausted and do not have the energy to create or maintain resumes solely for the purpose of a part-time teaching job. We need some flexibility in how we can hire instructors. We also need your direct help. Perhaps your professional networks include hospital administrators or physicians that could be activated as champions for our students. We need help reminding our hospitals that their participation in EMS training is essential, and our students need to know that PCC brought every ounce of influence to bear to ensure their success as they step up to serve our community. Thank you for
Robert.
listening. Please don't hesitate to contact me if you have any questions.
Thank you. Appreciate your time.
Yeah.
Alan Villegas.
Hello, I'm Alan Cordell Villegas, and I thought I was going to have 3 minutes to speak. I hope you'll allow me to speak the entire time. My husband was also signed up to speak, but he is nervous about speaking, so I'm going to speak for both of us. I've been at the college for 24 years. I'm a faculty department chair, and I'm a librarian at Sylvania. The first thing I want to say is off script. The 125 hours could have been spent much more usefully by talking to the librarians at PCC. We could have provided more and better sources, more up-to-date sources, and more balanced sources. And I heard a lot of things tonight that I found really disturbing, that I think many of our students that I've worked with over the years and tried to teach information literacy skills to would be troubled by. So now I'm going to go back on what I'm going to read. I'm here to advocate for my husband, Danny. I met Danny in Mexico City in 2012, and we fell in love. After many challenges and some help from Senator Merkley's office, Danny immigrated to the United States in 2015, and we got married in that year, within 90 days. You might know that TV show. Danny started the ESOL program in the same year, and he had excellent teachers, including Kate Carney, who I think might be speaking tonight. He's enrolled now in the interior design program, which I believe is one of the ones that's supposed to begin in person this fall. During the pandemic, he became a US citizen. He was excited to finish his associate's degree this coming year, but now he is afraid to return to PCC for his classes. Danny, like approximately 3 to 4% of all Americans, is immunocompromised. And although he is fully vaccinated, his doctor tells him that it's unknown if the vaccine will work for him at all. Like millions of other Americans like him, Danny may not have protection from COVID. His doctors also say that a test for antibodies, even if it shows a positive result, does not indicate immunity for him. He says Danny must continue living as though he is not vaccinated. His safety depends on the responsibility of other people. Likewise, although I am vaccinated, I am concerned that without a vaccine mandate in my workplace, my chance of getting COVID increases. And although I'm not worried about a serious infection for myself, I fear that if I return to the library at PCC, I am putting Danny at risk. Danny has had many deaths in his extended family from COVID, more than a dozen. And probably more than any of us here tonight, he is very aware of what the disease can do. This week, 2 of his cousins tested positive. They're in their 30s. They've had their first dose, but it wasn't enough. In Mexico, and like many other countries, people are anxiously waiting for the vaccine. But in the United States, in an article, I'm going to forward my sources to you, of course. One of the articles that I read refers to our vaccine hesitancy as a peculiar privilege. And by the way, vaccine hesitancy in the United States, current data shows that white people are the most hesitant group. I estimate that several thousand PCC faculty, staff, and students are immunocompromised. There are likely thousands of others like me who cannot risk infecting the immunocompromised people that we love. There is no way to safely and equitably accommodate us without a vaccine mandate. Let's not discriminate against Danny, nor any of the other PCC people affected. PCC may lose thousands of cautious students who cannot attend classes. And at the same time, PCC will miss an opportunity to educate and actively save lives in the community that we serve. Please reverse this dangerous decision. Thank you.
Thank you so much, Alan. Appreciate it.
Thank you for the extra time.
Jaime Rodriguez. Go ahead.
You're on, Jaime.
All right, thank you. My name is Jaime Rodriguez, and I thank you for the opportunity to speak on this subject. Thank you, Board Chair Alajuri and President Mitsui. Now more than ever, your leadership is so needed. And I want to welcome to the newest board members, Wilson, Cremona, Wagner, and Brussels, and thank you for your service to serve your community. Some crazy times, chaotic times, you name it. 2020 continues, and now we got to make some tough decisions. I am a former PCC employee of 20 years and current president of AFT Oregon, with locals PCC FFAP and PCC FCE as affiliated locals from PCC. We serve close to 3,000 members across the PCC district, from bus drivers to APs and both full and part-time faculty, and we're in the service of our students. Thanks for the reports and the documentation, the surveys, and the work to put it all, the info together. 125 hours, well, it took me about 15 to read it out, everything. So I do thank you guys all for putting that effort into it and try to make sure that we're informed as best we could. But even despite all those good efforts, there is a mass misinformation across the state, the nation, and the world as to where and what we should do regarding masking and vaccines. We cannot control what is happening across the country, but we can do something here at PCC for the safety of students, staff, and the overall PCC community. There is no right decision to be made, as regardless of which way PCC goes, mandate vaccines or not, there will be a group of those that will not be satisfied with any decision made. But I ask that you all follow the science. We have seen the increase of COVID cases rising in areas where vaccinations are low. We want to be safe in the classroom. With everything being proposed in vaccine clinics, the rise of ported area vaccinations, it only makes sense to mandate. Let's err on the side of safety. I am still in awe on the aftermath of the 2016 election, where PCC moved quickly to make PCC a sanctuary campus. It was a relief and peace of mind for immigrant and non-native students that they can attend class knowing that they are safe and can concentrate on their studies without fear. I ask this now. Let's have peace of mind. Let's save lives, not endanger lives. PCC has been a leader for community colleges across the state and the nation. Continue to lead. Now is not a time to stand on the sidelines, but to lead for the safety of our students. And continuing to educate and providing resources. The plan you guys have set in place is solid, with its outreach and its goal to maximize. AFT Oregon is here to help with resources as needed. Thank you all.
Thank you, Mr. Rodriguez. Thank you, Jaime. Can we have Michael Martin, please?
Hi, thanks. It's Michelle Martin.
I'm sorry, Michelle.
No worries. Board directors, thank you for holding this special session and giving people the opportunity to speak. My name is Michelle Martin, and I've been teaching math at PCC since 2007. When reading the report to the board and the links in the report, I noticed 3 things that motivated me to speak tonight. First, while I appreciate the concern for potentially blocking access to education for BIPOC communities by having a vaccine mandate, nowhere in the board report was there any data for the other impacts to these same communities. Here is part of the impact from one of the articles referenced in the board report that wasn't quoted in the report. Black Americans have had hospitalization and death rates 9 times as high as those for white Americans. The article goes on to share the impact to other BIPOC communities. Doesn't it make sense to also think about how a vaccine mandate at PCC could save lives and prevent long COVID? Second, some of the quotes were out of context. For example, in the Journal of American Medical Association article, where it was quoted that mandates can undermine public support, but could be useful in the future. This is an article from December 2020. Maybe we're in that future now for mandating. Third, under logistical considerations, I was surprised to see the dire effect of requiring COVID vaccines would be to the college's student systems and IT teams, how this would in effect end all of PCC's vaccine education. Wow, board members, this is a really hard choice that you seem to have before you, vaccine mandate or outreach to an education. I do wonder, though, if maybe there are other options. Perhaps the ESOL faculty doing vaccine outreach work might have ideas, and this decision isn't quite the stark false dilemma as it is presented in the report. Unfortunately, this administration has shown time and time again they don't like to involve faculty. I do hope this will change soon. Perhaps it could start changing now with collaboration with faculty and with students for continuing PCC's outreach education efforts if the board does decide to mandate vaccines.
Thank you, Michelle. Appreciate your
I will be
time.
emailing the board with additional thoughts on the report. Thank you for the time.
Thank you. Sarah Packer.
Hi, my name is Sarah Packer, and I teach ESOL. I'm scheduled to teach face-to-face for fall term, and I'm trying to picture what my classroom will look like and how I will promote student learning despite obvious limitations. But after teaching level 1 ESOL beginners on Zoom for 5 terms, I'm confident that I can do anything. But without a vaccine mandate, I assume that we're depending on masks for containment. And am I expected to enforce masking? What am I supposed to do if students take off their masks or wear them incorrectly or cough or sneeze on another student? How will we protect each other in the halls and bathrooms between classes? I'm shocked that the board has not been a part of this important decision-making process until now. I'm shocked that you were left out, but I'm not surprised. The COVID response committee also left out student leadership and union leadership. I also regret the poor quality of the information you have been given in preparation for this meeting. The statement that 80% of the student body has been vaccinated is based on a survey that represents only about less than about 15% of the student body. And I can pretty much guess that no ESOL students answered that survey. People are talking about how this is pushing the timeline of fall term. Because of the pandemic, we have plenty of unemployed and underemployed staff and faculty connected to PCC who come from diverse communities and who are ready to help get out the vaccine effort. We have students who speak 75 different languages and who can act as ambassadors in their various communities. We have almost 6 weeks until the start of fall term. If administration had decided to focus on the pandemic instead of the reorganization, we would not be pushing this timeline. Please, let's all get vaccinated together.
Thank you. Thank you, Sarah. Taylor? You're on mute.
Sorry.
It's
I thought
okay.
I'd unmuted myself.
I'll restart your timer. It's fine.
Thank you. My name is Taylor Geweiler. I've been with the school since 2007, and I work in central distribution services in the warehouse. I have been working on site since the day after we closed. And in the beginning, we were without masks because nobody knew what to do and they weren't available. We eventually got some from custodials, and then we ordered our own. I originally was going to tie decisions that you've been making back to our current bargaining dilemma, but I really want to address some of the things that I heard tonight. I have several friends in the Native American community. I have some friends who are both Black and Native, and there was a lot of hesitancy in the beginning about getting vaccinated. But all of those people that I know and their families have chosen to get fully vaccinated because they did experience people in their immediate families or themselves contracting COVID-19 and lost many members of their family and friends. So for them, it became an imperative thing and something that they worked to get access to. And yes, it was hard for some of them to access, and which is why I'm glad to see that PCC is now offering these things on campus. So if we do have students come back, it is an accessible choice they could make. I also wanted to say that I agree with, I believe it was Sarah that was just on, that my experience of hesitancy now is white people I know. So I do think there needs to be further discussion, and maybe it would be helpful for the board to have forums with specific groups of people of color to talk to them about their specific feeling on it, rather than go from a small survey that may not have reached a lot of people. I, for one, am vaccinated.
Taylor, thank you so much. Your time is up. I'm sorry.
That's okay.
We have to move on. I appreciate it. Thank you.
Sure. Thank
Kate Carney.
Yes, hi. My name is Kate Carney, and I am the chair of ESOL at Sylvania, and I've been at the college since 1998. Most of our students are people of color, many are low income and undocumented. ESOL will be running some limited on-campus classes in the fall. I understand there is a big concern about vaccine hesitancy among BIPOC students and not wanting to limit their access to PCC. I'd like to tell you a story that I hope illustrates how damaging a lack of a vaccine requirement could be to the very people we are hoping to help. One day last week at 9 p.m, an instructor in our program called me and told me that she had gotten a text from a student. This student was in the hospital with COVID and was about to be intubated. Her text to her instructor was a kind of a Hail Mary. She told the instructor that everyone else in her family, that's 5 additional people, also had COVID. None of them were able to work, and the family had no source of income. The student remembered the instructor had mentioned PCC emergency grants, wanted to know if they were available. The instructor and I then spent the next couple of hours trying to figure out how to help this family. And in a follow-up conversation with the spouse of the student, the instructor asked if they knew how to get a vaccine. The husband said other family members finally did get vaccinated after they had recovered. But perhaps it was too late for the mother of the family, who is now in the hospital on a ventilator. We do know how these stories are ending, unfortunately. A recent Kaiser Family Foundation study showed that vaccine mandates actually do prompt people to get vaccinated. The other thing that prompts them is knowing someone who is hospitalized or has died. Thinking about this family and their tragic situation, I do feel the kindest thing we could do is to require a vaccine of all students, faculty, and staff of PCC. Thank you so much.
Thank you so much, Kate, for your time. Thank you for your comments. All right, I think that's all we have for public testimony. I guess, my dear colleagues, I think this is time for us to decide.
Can I ask Kate a question before she leaves?
Sure, go ahead.
What was that study you referred to that showed?
Sorry, Director Saltzman, it's going to take a second to bring her back in as a panelist.
Well, I'm prepared to, we're gonna have discussion or motions or?
I think I'd like to put a motion for us to decide.
She was bringing Kate back, so
okay.
Director Saltzman could ask his question about this.
Yes, hi.
Go
You
ahead.
mentioned a study about,
Yeah, it's Kaiser
Vaccination.
Family Foundation, and I heard it on OPB, and I can certainly go back and look for the link, but they're very clear about the criteria, the things that make people get vaccinated: death, hospitalization, and mandates. Those are the three.
okay, thank you. Thank you.
Sure,
Thank you for coming back, Kate.
sure.
All right, so our decision now is, do we want to agendize this on the August 19th meeting as a resolution for a vaccine mandate policy? The vote tonight, we'll put it on the agenda, and then we can vote then as well. But the vote on the 19th doesn't add the other pieces that we mentioned, which is a timeline, if that's one of the components. It's just whether or not we want to mandate vaccinations to return to campus for students in the so go ahead.
I'm a little confused.
So the vote,
you know where I'm coming from. I want to do vaccinations.
Yes, so I guess
students, employees,
because we can't mandate that here at this meeting, we have to vote to put it on the actual agenda. And so that's what we're voting for right now. Do we want to put it on the agenda?
Why can't we vote on it at this meeting? I don't understand.
It's not a final resolution for us to do that. I think the normal protocol is to have them on the official meeting agendas, not on special meetings. Is that correct from the policy, from the Oregon statute? Trying to find it.
This is technically a board meeting, and so you can vote for anything, but because there's so many other layers with it, I'm not sure that it's ready for that kind of vote right now, but you can vote to move it forward to August 19th.
At the last meeting.
I have a motion I'd like to make.
I'm sorry, can you repeat that? Okay. Go ahead, ask your question, Christine, and ask Director to repeat his question.
I don't know how other people feel. This is really hard to do remotely also, but is there any steps between now and then that can better prepare us for the vote? Because I'm just wondering if the 19th, if they're going to be continued, questions and discussion needed, or if is there something we can do between now and then, I guess, or is anyone interested in talking more about this, or are we all feeling ready to vote for it? I'm new here, so I'm just throwing that out to the
Thanks, Christine. I think
I don't feel quite ready. I will be, but I just like that.
So I think you're cutting, maybe it was just for me, but I think what I understand is that you want to know if there's any more work that can be done between now and the 19th to better be prepared for that vote. And I mean, we have the retreat coming up, but that's not really, it can be, but Mark, were you going to say something?
So by board policy, we have a policy on agendizing board meetings. And we've already deviated from that rule to have this meeting. The board policy does state that there is a meeting ahead of time, and it's with the chair, vice chair, myself. We've incorporated a third rotating member, 3 instead of 4, to avoid quorum. And board members are invited on a rotating basis to set the board agenda for the meeting. Because there was such interest in this topic, and because we originally had scheduled this discussion to occur at the retreat, but there's only half an hour to do it in, that it became clear we needed more than a half hour to talk about this. And that's why this special meeting was scheduled. The only time that worked for everybody that was prior to the next board meeting was tonight. And so that's why this ended up being in this way, and why, you know, we rushed to get the data ready for the board. So normally this would go through the agenda setting process. My understanding from the last meeting was that this discussion tonight was about whether or not to put the vaccine mandate decision on the August 19th agenda. And I thought there was pretty wide agreement that the board wanted information, that there would be a discussion, and that the decision would be whether or not to agendize it on the 19th. So yes, that's my understanding.
Yeah.
And
Thank
so
you,
that's
Mark.
how we operate, yeah.
Thank you, Mark. Yeah, and I think as you all know, is also within the time frame of past the agenda. So, Jeannie, have you sent the final agenda for the 19th or not yet?
The draft agenda has been sent out.
Okay, which means that this will be an amendment to that, which is fine. We've talked about having that be an option.
Well, it would not necessarily be an amendment because the final agenda has not been published.
Yes, amendment to the draft. Thank you.
Yeah.
So yeah, go ahead.
Can I clarify? So a question to kind of clarify Christy's question. It's then my understanding that I think maybe what Christy was also asking, and go ahead and correct me if I'm wrong, Christy, is like, we have the resolution that Dan has put forward. And so that is what we would be voting for on the 19th. But if we wanted to make any amendments or have any further discussion, that's what we would, is that what you were kind of asking, Christy? Like that's having more time to discuss that and fine tune that resolution before the 19th, before we vote on it.
So if it was a resolution, it would have to be sent out with the agenda, as Jeannie often does. And so I think we need to come up with a resolution before then. And it wouldn't necessarily be the one Dr. Salzman sent. It would be, it can incorporate it certainly in other things as well, plus information we heard from today's meeting, anything we think would meet the intent of the resolution. And then it would be sent out for us to have for the agenda. Is that correct, Jeannie?
Correct.
Okay, go ahead, Dr. Salzman.
Well, I'm all in favor of having a vote on the mandate question at our meeting of the 19th. And if Director Wilson and others want more time, that's fine. But I want to make sure we have that vote, I guess.
Okay. So in that case,
I'm prepared to make a motion tonight.
No, I'm going to make a motion. I'm going to make a motion right now. A motion to put this discussion or this decision on the 19th agenda. That's what you were hoping for, right? Okay. So I'm putting a motion. Do I have a motion to put that on the agenda? I'm asking for a motion, I guess, not putting it.
I would so move.
Thank you, Director Salzman. Do I have a second? Second motion to put this on the agenda on the 19th.
For the sake of discussion, though I may end up disagreeing with Mr. Salzman, I will second the motion because I believe discussion is fundamental to anything close to a free society.
Thank you. All right, I guess we've had discussion. Any further discussion?
I would add that in light of some of the logistical challenges, I'm certainly open to having the vaccination policy apply starting winter term. But I still believe we should vote, because of the logistics, we should vote on something on the 19th to set that wheel into motion. And I also believe that we should have the president work with Multnomah and Washington County Health Departments to have vaccine clinics on our campuses, our 4 major campuses, 2 weeks before fall term starts, and then again 3 weeks later. We have the opportunity to get thousands of people vaccinated. We should not let that slip through our fingers.
Thank you. Thank you, Dr. Salzman and Dr. Sunliner. With that, Gloria, you want to take a roll call?
Yes, thank you. Director Cremona Wagner.
Aye.
Director Sonleitner.
Aye.
Director Bussell.
I'm voting no.
Director Saltzman,
Aye.
Director Wilson.
I'm gonna vote no only because I don't know if I can explain why right now, but it's just because I've heard the word around the resolution is like rushed, and I don't want to feel rushed in 9 days. So that's why I'm voting no.
Okay. Vice Chair Penson.
This is to move this forward to further have conversation and vote on for August 19th, right?
Correct. Just because we're approving it now does not mean that it will be approved on August 19th.
So I'm going to say yes, but the reason I am going to say yes is because everything is ever changing. And so we don't know what next week may look like. So this should be a conversation. So yes.
Okay. Chair Aliajuri.
I'm going to vote no, but I welcome the motion passing for us to talk about it next week or at the next meeting. So thank you, everybody. The motion passes, and we will discuss this on the agenda on the 19th. I will work with President Mitsui and Vice Chair Penson and whoever else is going to join us to work on the resolution. I think, again, Director Salzman had a really good start to it. We can incorporate some of it into it, and then we can put it to vote on the 19th. Is that agreeable to everyone?
Sorry, how will we all have input?
Well, we'll send out the draft resolution like we do often. Hopefully, I know timeline is always an issue with us, but hopefully go ahead.
And just to be clear, just because we post an agenda with a resolution doesn't mean that it cannot be changed in that week.
Yes.
So things
Even
can be
during
edited and
the
updated.
meeting.
Yes, even during the meeting. So.
All right. Thank you, everybody.
When will we see
go
the
ahead.
draft resolution?
Good question. Let's see. The 19th is only 9 days away.
Not that far away, yeah.
Yeah. How about I bring something to the retreat as an initial draft?
Right.
Is that fine?
I thought
Mark?
we were not, this is what the special meeting
Yeah,
is for.
I think
I thought
Mohammed,
we
if you
I'm
were.
sorry. Did I misspeak? Well, go ahead.
Yeah.
Sorry.
And
Just a second.
so yes, Tiffany is right about the retreat, Mohammed, and you have to be careful about public meeting rules.
No. I meant by then, not to use that during the retreat. But
Okay. Okay.
Yeah. Sorry.
Okay.
We'll try, but obviously we need to have it before the meeting by a couple of days at least. And so retreat gives us 4 or 5 days. Of course, that's pending, if Mark has time to have some staffing with us. Jeannie, are you available to work on that offline?
Uh-huh.
Okay. Mark, do you have anything to add? Sorry, I kind of skipped over you.
Nope. No further comments.
Thank you.
So will this be on the regular agenda on the 19th as opposed to the consent agenda? Is that correct?
Yes, it's going to be a roll call. All right. If there aren't any last minute questions or discussions, we will adjourn this meeting. Thank you, everybody, for a great discussion. And again, we've special meetings often, happen throughout the year. So please be prepared that these can come up once in a while. And it's nice to have everyone's attention and presence. And we've had a good turnout. 85 people, I think, joined today, which is pretty much the highest I've ever seen it. So testament to this issue and this topic. So thank you, Gloria and Jeannie, for your support. And looking forward to seeing everyone on the 19th. Have a great night. Meeting adjourned.
Thank you.
Great. Thank you all. I'll go ahead and close out the webinar now. Everyone have a good night.